You're listening to Upgrade Your Health and Wellbeing podcast. Take care of your health and change your habits for the better.
Welcome to another episode of the Upgrade Your Health and Wellbeing podcast. Today we're talking about zinc.
Zinc is an essential trace element, but in supplementation it is most effective when correcting deficiency. So exceeding safety thresholds increases the risk of adverse effects, especially copper deficiency, anemia, and neutropenia. And clinical evidence supporting routine supplementation focuses particularly on neurology, dermatology, and fertility.
Arku, let's start with the question. What exactly is zinc?
As I said, this is a trace nutrient, micromineral, that is related to the whole functioning of the body. Today we are discussing one of the most commonly used supplements worldwide, because this is widely promoted for immunity, skin health, male fertility. So this is the nutrient where the line between beneficial and excessive intake is surprisingly narrow, especially with long-term supplementation. And zinc is not only a supplement. As we know, it's a structural regulatory ion involved in over 300 enzymes and more than 2,000 transcription factors affecting virtually every major biological system. It regulates gene expression, immune system. So zinc is essential for both innate and adaptive immunity. It regulates T-cell maturation, C2-4 to C2-8 balance. A deficiency of zinc results in impaired immune response and increased infection risk. Of course, zinc is also essential for insulin synthesis, insulin storage, and insulin secretion. It also improves glucose metabolism, which is of crucial importance, and insulin sensitivity.
So Arku, I was wondering if you could tell me what exactly should be the properly recommended daily dosage that we should all be taking, specifically when it comes to our intake of zinc?
As far as the recommended intake is concerned, there is the difference between a US dosage and European dosage, and in terms of upper tolerable intake level, right, which we are going to discuss in a minute. Misunderstanding this difference is one of the main reasons why zinc supplementation is often misused. And in the United States, the recommended dietary allowance is 11 milligrams per day for adult men and 8 milligrams per day for adult women. Whereas in Europe, recommendations vary more, typically between 7 and 16 milligrams per day, because zinc absorption depends obviously strongly on diet, composition, and therapeutic doses used to correct deficiency are usually higher, often in the range of 15 to 30 milligrams per day, sometimes temporarily higher, but under medical supervision.
What is the maximum tolerated dose?
The tolerable upper intake level is usually 25 milligrams per day, according to European authorities, and 40 milligrams per day, according to US standards. But we need to bear in mind that these limits include zinc from both diet and supplements. So the key reason is the effect on copper metabolism, because excess zinc interferes with copper absorption in the intestine. So over time, it can lead to copper deficiency, which has serious consequences.
What are the side effects of excessive zinc supplementation?
First of all, nausea, abdominal pain, vomiting, these are the most frequent. So generally like gastrointestinal discomfort. And these symptoms are relatively common at higher doses, right? However, the most serious concern is chronic high-dose supplementation. So long-term intake above 50 milligrams per day may result in, as I've already said, like copper deficiency, which is a serious case, anemia, neutropenia, and these are serious problems because they are related to impaired immune function.
How is zinc used in psychiatry and neurology?
Well, zinc in neurology and psychiatry, well, it plays an important role in brain function because it is involved in, first of all, neurotransmission, synaptic plasticity, neurogenesis, and also regulation of inflammatory processes in the brain. So as you can see, this is a very important case. The strongest clinical evidence exists in depression, for instance. Some meta-analyses of randomized controlled trials, for example, suggest that zinc supplementation, typically 25 to 30 milligrams per day, may reduce depressive symptoms, for example, especially when used alongside standard antidepressants antidepressant treatment. However, we need to bear in mind that the results are not consistent across all studies. So for other neurological and psychiatric conditions, including Alzheimer's disease, Parkinson's disease, ADHD or schizophrenia, the evidence is limited.
What is the significance of zinc for our healthy, good skin, for example, in dermatology?
It's very important because zinc in dermatology, it has certain distinct roles. In common skin conditions such as acne, inflammation and infection, zinc may provide some benefit. Some studies suggest, for instance, that zinc has anti-inflammatory effects, right? This is the first thing. Second of all, antibacterial activity. And it plays some role in wound healing. So generally, zinc regulates proliferation, collagen synthesis, for instance, and particularly, what is particularly important, wound healing. And zinc regulates also sebaceous gland activity.
There is a lot of talk nowadays about the demographic crisis. How does zinc affect fertility?
That's a very good question. First of all, we need to focus on male fertility in this respect, right? Zinc plays a critical biological role in male reproductive health. It is essential for spermatogenesis, for instance, right? Sperm motility, this is a crucial factor. DNA stability, for instance, right? And of course, testosterone metabolism. So low zinc levels, we may say, are associated with impaired semen quality. The prostate contains one of the highest zinc concentrations in the body. So zinc stabilizes sperm DNA and protects it from oxidative damage. It also protects sperm from oxidative damage in general, reducing conversion of testosterone to estrogen, for instance, right?
Honestly, zinc, I think, is one of the most completely underrated supplements. If we were to sum it up in just 3 sentences, how would you summarize why we should supplement?
So let's summarize. First, zinc is essential, but the recommended intake is typically 8 to 11 milligrams per day. Exceeding safety limits can cause adverse effects, particularly copper deficiency, anemia, but it is of crucial importance to bear in mind how important zinc is. And clinical benefits of zinc supplementation are most evident in deficiency states. So evidence supporting routine supplementation in neurology, dermatology, male fertility must be stressed. And the most rational approach generally is targeted supplementation, which is based on clinical indication, proper dosing and awareness of safety limits. These things are significant.
Thank you very much.
Thank you very much for today.
Upgrade your health and well-being podcast. Take care of your health and change your habits for the better.